sobre o assunto é a doutora Geeta Singhal, que é professora de Pediatria da Faculdade de Medicina de Baylor e também é pediatra hospitalista e chefe do Serviço de Pediatria Hospitalar do Texas Children's Hospital. Então, passo a palavra para a doutora Geeta.
Thank you. Thank you so much. I'm so happy to be here today and to be in your beautiful country. It's been really lovely. We flew into Rio yesterday morning, and then we came to Porto Alegre yesterday afternoon, and we've been having a nice tour of the city, and we also ate some wonderful Brazilian food with Fabiana. So thank you for this honor to be in your lovely country. So I'm a general pediatrician, and I like to ask the audience lots of questions when I give a talk. So I'm going to ask you all lots of questions. So I hope you will raise your hand or yell out an answer. Okay? It's very important that, to me, that you understand my concepts. I'm going to talk about the field of diagnostic error, and some of the concepts may be a little bit difficult at first to understand. So please raise your hand and ask me some questions. Okay. All right. So, to start, I don't know if you can understand this, but I love this. I was walking in Chicago, and I saw this poster. And it says, "Welcome to a place where we talk, question, wonder." You can read the rest. Oh, sorry. Can you see it? Okay. Debate, disagree, investigate, and you can read the rest. And that's what I think about when we're in medicine, when we're seeing patients. We should have an environment or set up a place, and I see somebody nodding, where we can talk and question, where we see a patient and we can wonder about what's going on with the patient, where we can study, analyze, test, and share what we've learned. And I would say Ricardo and I and the hospitalist where we work with, we do that a lot. So it's great. That's what makes us good doctors. Okay. So I'd like to talk to you about the field of diagnostic error. Diagnostic error is considered in the field of patient safety, and it's a very important topic. It's very important right now and very popular to talk about the United States, and I'll get to that in just a moment. We're going to talk about diagnostic errors, and there's many reasons we make errors in diagnosis. One is because of us being human beings, that we are human when we take care of patients. We're going to talk about how to be better about making diagnoses, and then we're going to finish up with some what we call cognitive strategies in terms of making diagnoses. And many of you, and I apologize, not all of you received it, but in your packet that we brought from the U.S., there is a small card. It's red in color, and that goes over a lot of the concepts that we'll be covering today. So you can take that back and look at it in your own convenience, in your own time. Okay. So I'm going to ask you guys a question. What do you think is the most common type of medical error? And your choices are diagnosis-related, medication-related, monitoring, especially for pediatricians, that where we lose the child to follow-up, prevention-related, for example, if people are not washing their hands and they're walking from patient to patient, so we spread infection as physicians and care providers. Or would you say surgery-related? So, for example, the United States, a lot of times, well, not a lot, actually not that often, a surgeon may operate on the wrong side, but it makes lots of news. So who wants to answer? What do you think, at least in the U.S., what we think is the most common cause of medical error? Okay, I have D. I have B. There may be a hint because of the title of the talk. So what we're thinking is actually it's diagnosis related, at least in the U.S. We have very limited data about that, but when we look at malpractice data, so reason that people file lawsuits, we're finding that people file lawsuits because of failure to diagnose or wrong diagnosis. That's the most common cause of lawsuits in the U.S., what we're finding. There's a large malpractice database at Harvard called CRICO-RMF, and that's what their largest cause of lawsuits is. Okay, so now I'm going to ask you all another question. Why, first of all, and it may be hard for the medical students to kind of relate to this, so maybe think about a patient that you've seen with your professor or supervising doctor. If you have missed a diagnosis in the past year or seen someone miss a diagnosis, why do you think that was? And all the answers are correct, but I'd be curious to hear why you think you may have had a problem making a diagnosis. Was it the diagnosis didn't cross your mind? You didn't listen enough to the patient's story? You paid too much attention on one finding? Too much in a hurry. That's my problem. I'm always in a hurry. Didn't reassess the situation. Didn't rethink the situation. Influenced by a similar case. So thinking about Ricardo's talk, if you saw a lot of patients with pneumonia, then you were kept thinking, oh, pneumonia, pneumonia, pneumonia. Talk myself out of an upsetting diagnosis. What I mean is, maybe I see a child who has cancer, but I don't want the child to have cancer. I'd rather the child have an infection. Okay. Does anybody want to give a thought? There's no right or wrong answer. This is just for us to talk about.